Hi, this is Dr. Richard Downs with the Dental Chiropractic Collaborative at dentalchirocollaborative.com. And I have on the line with me today Dr. Chris Farrugia, who I have learned a great deal about and have had the privilege of learning from him on medical billing. So we're going to talk a little bit tonight about medical billing. It certainly won't be anything comprehensive, but I want you to know what Chris has to offer. And we work closely with Chris. Also, his online courses he's going to show you are available to you at discount through Dental Chiro Collaborative. But I'm going to first just read a little bio that I have on Chris because it's pretty impressive, and I want to go through it. Hopefully, I won't mess it up too bad, Chris. Thanks.
No worries.
Okay, thanks. So Chris is a nationally recognized speaker, teacher, and leader in digital dentistry and in medical billing by dental practices. Dr. Farrugia practices digital restorative dentistry in Destin, Florida, utilizing advanced technologies such as CAD/CAM and 3D CT imaging to provide comprehensive, high-quality care. He speaks to and trains dentists nationwide who want to advance their practices with digital CBCT imaging, digital restorative dentistry, including all CEREC procedures and materials. CEREC Galileo's integration and 3D printing to successfully access medical benefits for their services, which is what I'm mostly interested in. That's why we're speaking tonight. He has DDS degree from Emory University in 1982. He's an alumnus of L.D. Pankey Institute, certified CEREC Basic, Intermediate, and Advanced Level Trainer. He's a medical director for Pensacola Imaging. He's a contributor to CEREC Doctors Spear Education Curriculum. He was the featured speaker at Sorona 3D Summits in 2014 to present. He was former owner of Artistic Dental Laboratory Services. He's an author, many different books that he has done on medical billing, custom ceramic posts and cores, and an overview and rationale of new use of proven technology. His company is called Successful Medical Billing, The Dentist Guide to Fundamentals, and Successful Medical Billing, The Dentist Guide Advanced. I have both of those books, and I'm reading through them again. These past presentations include the American Academy of Oral and Systemic Health, Dentsply Sorona World and Ciro World, Patterson Technology Summit, Yankee Dental Meeting, University of Maryland School of Dentistry, Florida Dental Convention, the Medical University of South Carolina Technology Symposium, American Academy of Craniofacial Pain, the Winter Meeting, and the North Carolina Technology Symposium in November 2015. So thank you, Chris, for being online with me.
Wow.
Very nice. So I first got to know Chris, a course that he presented with Kendra Sellers, who now works with you, right, Chris?
That's correct. She's in-office coaching for practices that want a little extra help as they implement medical billing. That's correct.
Yeah, and one of my Dental Chiro members has just recently had her come in, and she did an in-office seminar and helped train them. And I've heard really good reports about her abilities. She's done wonderful things for my practice, Chris. She brought me in. She's doing a number of medical billings. I do advanced surgical techniques in implantology and grafting, and I know you've helped her with my practice in her training. And I've even gotten a case where I've had over $60,000 of revenue from the insurance company, medical insurance, for one of my cases. We're just doing the prosthetics on her right now. And we just did our second surgery on her mandible, and that's coming, and that's going to be restored in a few months. So thank you for your help with that. It's been fantastic. Yeah, it's really changed my practice. Have you heard those stories before, Chris? Satisfied dentists?
Yes, certainly all dentists don't practice to the level that you do, Rick, but when you're doing major surgical reconstructions, medical insurance is a very viable alternative for assisting patients with affording that type of care. $60,000, $70,000, $80,000 cases are not the the norm, but they are happening with more and more frequency as dentists are starting to take advantage of that revenue stream.
That's right. And I can just tell you that one case like that or two cases like that in a year can really change the way you practice, because I know from experience that it has done wonders for my practice and the enthusiasm of my staff. I'm going to pull up the questions, Chris, that I have for you that I wanted to go over tonight.
All right.
We may not get through all of them. This is kind of an informal get together, and I want people to know what you do, because I want them to enjoy the benefits that you can give them,
Sure.
the experience I've had. So let's go ahead and do that. Now, let me just go here, interview right here. So one of the things we're going to, I think I want Chris to do is that first I want Chris to show you his website. I'm going to have you share your screen, Chris, and show you what he has to offer for people that might be interested. So go ahead and do that, Chris, and just take us through that a little bit. Go ahead.
This is SMBDU, which stands for Successful Medical Billing Digital University, but at smbdu.com, the course contents that I teach are available in a video format so that you can access them at your convenience, learn at home if you wish, learn with staff. And we have a wide range of video topics. It's grouped by courses. Each course is constructed out of various modules. The place to start is with the fundamentals course. If you're new with medical billing or have no experience, you would want to start with fundamentals, which basically walks you through the medical claims process from start to finish, everything that you need to know in order to be paid by medical insurance. And then we have an advanced course that takes greater detail into areas of clinical interest. And there's a separate course that is for those practices that are only interested in surgery. We'll be adding more courses as the year progresses. By the end of the year, we expect to have one specifically on obstructive sleep apnea. But these are all on SMBDU. There's some free content that if you want to go and just browse around and get some basic information and see what we do, that's available as well. And for those that just have very specific needs, the individual modules are also available for purchase. But this is our online video content portal where this information can be found.
Right. And so, Chris, and you gave me a special code for my my members that is on the membership site. So I just want you to know that Chris has been generous about giving you some special pricing on some of these. Matter of fact, all these items that you're seeing right now. So
Sure.
Chris for that. So Chris, you also do seminars around the country in live, do you not?
That is correct. And from this website, I have a sister website that is successfulmedicalbilling.com, which is where my live site, my live course schedule can be found. And it's published on the schedule tab, and you can find where the live courses are available as well. And I'm happy to remind your audience that the same discount code would help them with the live course tuition if they would prefer to learn in person in a live format as opposed to the video. But the schedule is found there, and we offer these courses around the country at various cities, various times, but the schedule will be always found on successfulmedicalbilling.com.
Yes, and I encourage people to go to these live courses because you're going to want to ask questions, and there's lots of questions, and then supplement them with these books that he's showing right now, and also the online courses later. I think the live course is really, really helpful. Do you have any information on these two websites on the TIPS medical billing offers?
I'm sorry, I didn't hear the question.
Do you have any offers from TIPS, Kendra's in-office schedule?
Yeah,
on here? Sure.
That,
Go ahead and show them
that actually is an affiliate program separate from what we do, and I would encourage your audience to contact Kendra directly, and she
that.
can
Yeah. Okay.
inform them of what she can do.
That's great. Thank you, Chris.
Mm-hmm.
So let's just go into some of the questions I had for you because I'm still learning, and
Sure.
I just got a few questions that have been my staff has asked me, and I'd like to ask you because I think what we most want to know about is, first of all, Kendra told me that we are starting now to do annual medical billing for
Mm-hmm.
annual exams. Tell us about annual exams and what a dental office can do in their area of annual examinations that are medically billed.
Well, for any exam that we perform as a dentist within our dental practice has to be medically necessary in order for it to be paid by medical insurance.
Right.
And to be medically necessary, you have to go beyond examining the teeth. If we only count teeth and do a dental exam, that's not paid by medical insurance. But conscientious dentists always go beyond counting the teeth. We start with an extraoral exam that typically starts near the thyroid, the muscles of the neck, the structures of the neck, TMJ, range of motion, just everything that is extraoral. And then even intraorally, we're assessing the airway, the tissue, the tongue, the tonsils, and things like that. And it's that component that makes the exam medically necessary, because basically we're looking for changes or abnormalities that have occurred since the last physical exam,
Right.
just like a physician that performs an annual physical. And for our exams, an annual physical exam of the head and neck area is paid by medical insurance once a year, just like an annual physical.
Mm-hmm.
However, additional exams are billable and payable when new developments or new issues have to be evaluated. But just an annual physical exam, if someone comes in and you haven't seen them in the last 12 months, that exam is billable to medical insurance. Now, in a dental practice, these patients typically will return 6 months later for recare.
Right.
And if they have no new complaints, nothing new at that 6-month interval, then that exam would not be billable to medical insurance.
Right.
However, it's very common, as you know, for patients to wait and give their complaints when they arrive for recall. Oh, Dr. Chris, my joint has been popping since the last time I saw you. Well, that's actually a new complaint, which would make that exam then payable.
Right.
But just healthy patients that are just there to have an evaluation done, looking for abnormalities since their last annual physical exam of the head and neck, that would be billable once a year.
And then what would be the advantage of a dentist billing medical rather than dental for these annual exams?
Well, the allowance for exams is much higher with medical insurance, so they actually will pay, and often in combination with the dental insurance, then the dentist actually will find that they are reimbursed up to their full fee, because we write off a lot of things, particularly if you're a PPO practice or PPO participant in any dental plans. We give up the right to balance bill patients, and they only pay a fraction of our exam fee. Mm-hmm. So medical insurance will fill in that gap, because even if you're a dental PPO provider and you've given up the right to balance bill the patients under the terms of your dental PPO contract, you've not given up the right to be paid additionally by other insurances the patient may have, including medical.
That's an amazing insight. And and as I read in your book, we're the only profession that can bill both medically and dentally. Can you expand on that a little bit?
Well, I explain this where the dental profession as a whole, I feel, has isolated itself from medicine as a whole. Mm-hmm. And there are some practitioners that choose to bridge the gap and recognize that we are more than tooth mechanics and tooth treaters. Mm-hmm. And that positions us uniquely to recognize that when we have medical necessity, that we can access both medical benefits and dental benefits as well, mm-hmm. to be reimbursed up to our full fee. And that's just a great approach. I know that when I implemented medical billing in my practice, that the result of that was that my practice became a medical style practice that also treats teeth.
Right.
And that subtle difference in perception will help dentists understand how to look at patients differently and understand why medical insurance is a valuable resource.
And one of the advantages I saw in reading your book was that it also preserves the patient's dental insurance benefits for things that are just dental.
Absolutely, because if you go to medical insurance for payment first, and if they pay you in full, then you have no reason to go to dental insurance.
Right.
You can save those very small dental benefits for when they have a dental or tooth issue that needs to be treated.
Right. Thank you so much. That's very helpful. Now there's more to know about that, and I'm working with Candor to learn more. So I really appreciate those words.
Good.
I'd like to talk about CT scans, because I know that you said that one of the reasons you got started in medical billing is because you bought a cone beam and wanted to learn why not medical paying for these things. So tell us how we can bill for cone beam CT scans.
CT, the purchase of that expensive piece of equipment is the reason that I learned medical billing. Because I wanted to pay for that technology. It's very expensive, and it's an expensive medical device that performs an expensive medical test that's paid by medical insurance. So my premise was, why shouldn't I be paid by medical insurance? And what I learned is that with any advanced imaging, whether it's MRI or CT or any kind of three-dimensional advanced imaging, that medical insurance has certain rules that have to be followed in order for the CT to be paid. Number one, first and foremost, it has to be medically necessary, which means that you have to be trying to evaluate some condition outside of the teeth. A CT to find an MB2 canal during endodontic therapy, that is only dentally necessary and will never be paid by medical insurance.
Right.
But when we are evaluating issues outside of the teeth, such as bone or TMJ issues, where two-dimensional radiography is inadequate to arrive at a diagnosis, then it's appropriate to order CT and be paid for it. So it comes down to medical necessity and then following the rules that the insurance companies typically have before they will pay for advanced imaging. And typically that involves pre-authorization. They want to know in advance before you do this, before they will pay for that. So most CTs have to be pre-authorized. The biggest exception to that is someone that presents as an emergency or a trauma or something like that. But your basic run-of-the-mill CT where the patient is not in an emergency situation needs to be pre-authorized before they will pay for it. And once it's pre-authorized, then you're good to go as far as payment.
Thank you, Chris. I'm set up to interview a representative from CareStream on CT exams and how they might be appropriate for airway patients.
Yes.
I've heard the pros and cons about using CTs for airway, but it seems to be becoming more and more popular as a possibility of medical necessity and doing, not that it can diagnose sleep apnea or obstructive apnea, but it can be a help in that area. Do you know, can you give us some insight on your feelings about that, Chris?
Absolutely. And being a CT owner, the technology allows us to really assess the problems with the airway in 3 dimensions. And like you said, it is not a diagnostic test, but it certainly is an adjunct. A lot of CTs can actually show the effect on the airway by advancing the mandible. These things are invaluable in treatment, determining a starting position for an appliance, those sort of things. But as with anything, the medical insurance company has to catch up to clinical practice, because what you're describing is what's going on in clinical practice and what we as clinicians see.
Yep.
Medical insurance will not routinely cover things until there's a preponderance of scientific studies that say this is the standard of care.
Exactly.
So today, As far as airway and CT, let me say this, that the standard of care with most medical insurances regarding airway and radiography is they will pay for an orthopanogram
Right.
and a lateral skull. And
Right.
some will pay for CT, but not all. So this is a insurance company by insurance company decision
Right.
on how they view CT and airway.
That's exactly what I found too, Chris. And when we talk to the CareStream people, we're going to go over different parameters, how much you can measure, how much opening you can measure, and how you can do it. We're going to go through the technicalities. So that interview is going to come up within a week or two for all of you to know, and just want you to know that that's coming up. And
Well,
Chris, you might want to see that too.
I would, and I will tell you this, that I know Blue Cross Blue Shield of Louisiana is an example, that a dentist that treats sleep actually sat down with the medical director for Blue Cross Blue Shield of Louisiana and showed them the valuable information that CT provides, and got his attention when he showed him that it would save his company money.
Right.
Dentists would have this information available as they went through and treated the patient.
Right.
That affected the change in Louisiana, where Blue Cross Blue Shield of Louisiana will now cover CT for airway for that reason.
Yes, I could just tell you that a couple of months ago, I did a peer-to-peer call with Blue Cross Blue Shield of Tennessee on a denial because they wanted to do CPAP first on these patients. They had some kind of policy about CPAP first, which is an ancient, antiquated thing to do.
Yes.
I explained to her that 50% of those are failed. Also, oral appliance, when you have that much failure rate, especially in mild to moderate. And I convinced her that the insurance company would save money by going to oral appliances first on mild to moderate cases. And I think that she was surprised by the statistics I gave her. And they will listen to money. They will listen.
Absolutely.
Absolutely. Oh, thank you. So, so you answered my questions about pre-authorization or not. I think CT scans should be prior authorized. Is there a way to go back 6 months on CTs you've already taken and get claims paid for those?
Well, keep in mind that all insurance companies don't require pre-authorization for every CT. So there's benefit to just go back 6 months and file claims, whether or not you can get retroactive pre-authorizations. Some companies certainly will issue a retroactive pre-authorization. I think in my experience, the farthest back that I've gone is about 2.5 or 3 months. So you may not be able to get the pre-authorization back 6 months or further, but there's certainly benefit to going ahead and filing the claim because it may be paid even without the pre-authorization.
Very good. What you said about bone, Chris, Candace always telling me it's all about the bone, and especially for a surgical practice like mine, it's all about the bone. If you have a pneumatized sinus, a highly pneumatized sinus with atrophy of the bone, tremendous bone atrophy, you have a medical reason for getting your bone grafts and reconstruction of the jaw paid for. So this is the route we want to take when we're doing these billings for surgical practices.
Absolutely.
Okay. Let's talk a little bit about titration, HST titrations of your oral appliances.
Yes.
How often can we bill for an HST for those titration appointments?
Most insurance companies will certainly pay for at least one titration study. So I tend to try to do mine when I'm pretty confident that we've reached maximum medical improvement with the oral appliance, that the patient is reporting they're feeling better. Getting a second, third, and fourth titration study will depend on the policy of that individual insurance company. But they will all pay for at least one titration study because they certainly understand that they don't want patients assuming that the appliance is effective without it being documented.
Yeah.
So one and maybe two is really not problematic, particularly if there's need for additional advancement of the mandible and titration of the appliance. Certainly a second one. I personally have never been paid for a third or fourth because some insurance companies will specify they will only pay for one or only pay for two.
Sure.
And after that, you would have to get it approved on a case-by-case basis.
I know in my case, I wait for the subjective symptoms from the patient that it might have improved their
Sure.
assessment. And then I also do pulse oxes routinely. I do the pulse oxes at no charge.
Sure.
I don't know if I'm doing the right thing about that, Chris, or not. But and then when I feel that I've got the patient ready for an HST, I do it. Is there a time limit when you can do that titration HST?
Not at all. As you know from practice, typically that's not going to fall through the cracks because we're going to be monitoring the patients as they advance the appliance and report back to us. I'm aware of no limits on as far as the time frame from delivery of the appliance to a titration study. But I think clinically, it's always going to be done within maybe a few months to somewhere in the 2 to 6 month range after delivering appliances is pretty typical.
Okay, and then I'm gonna go just a little bit into Medicare now, Chris, and then I'm going to wrap it up because I think you presented really well. Just a little taste of what you offer and what can happen, because there's a lot to learn here, but the rewards are extremely high.
Agreed.
You do teach a little bit about Medicare and billing Medicare for
I
not
do.
only surgical but sleep. I'm thinking. Yes, go ahead.
Yes, and we don't we don't specifically teach Medicare. Medicare is just a different form of insurance.
Yeah.
The universal truths that are taught regarding billing commercial medical insurance apply to Medicare, plus Medicare's additional rules and obstacles that they put in the way. So as you learn to navigate it, it's just best for people to start out learning commercial insurance and then adding the Medicare layer as they peel the onion back. But the same codes and diagnosis codes and procedure codes, the way you fill out a claim form, all of that is driven by Medicare, and the same in both the Medicare world and the commercial insurance world.
Okay. So, Chris, most dentists are DME providers. They're not doctors when they get signed up for Medicare. They're actually a DME, or a durable medical equipment provider.
Well, if you want Medicare to pay you, you're absolutely right. You have to be a DME supplier that is participating with Medicare. That's absolutely a necessity.
But if you want to get paid for surgical billing and for other things that are medical necessity, then you have to get a different Medicaid or Medicare status. Is that correct?
Correct. You have to opt in as a Medicare provider.
Right.
So as in clinical practice, we are Medicare providers. As a sleep appliance distributor, we are Medicare DME suppliers.
Right. Presently, though, as a DME supplier, I can't get my exams paid for, my HSTs, X-rays with Medicare. Can't do that.
That's correct, because they view a DME supplier of oral appliance exactly the same as a supplier of a CPAP.
Right.
Doesn't perform examinations, or someone that supplies prosthetic limbs. They're just expected to supply the appliance. That's right.
You think a dentist is advised to try Medicare, or should they just go into medical billing for regular insurance and get accustomed to that before they even venture into Medicare providers?
Well, I think the question really comes down, Rick, to what does the practice perform? What procedures are routinely being performed that it's worth the time?
That's a key, isn't it?
That Medicare actually pays reasonable amount of money to the provider of those services.
Right.
And there really aren't a lot. Sleep appliances are one. Depending on what the lab bill is, there is, you can survive on Medicare's allowance for that. The other thing from the surgical end is typically bone grafting. That's the one thing that I would say that Medicare pays a decent amount for.
Right.
That we can survive on their allowance fee and be compensated for our time is in bone grafting.
All right. Well, very good. Well, Chris, this is pretty much the sum of what I wanted to go over tonight. I know there's a lot more. I mean, we're talking about days and days of seminar information that we could learn, the particulars of what coding is and how to do it. Those things are not the scope of this discussion, but I wanted the people to meet you, understand the expertise that you have, and I want my clients to be able to get the benefit from you that they need to get. And so I'm highly recommending Chris Farrugia. If you need more information, where should they go, Chris?
Either of my websites, and I can be contacted. We have a contact form on both of them, and those websites are successfulmedicalbilling.com, which is easy to remember because there's medical billing where you file claims and you don't get paid, and then there's successful medical billing where you do get paid, and that's the name of my website, successfulmedicalbilling.com. And then our digital university sister site is SMBDU, Successful Medical Billing Digital University. And both of those sites, Rick, have a contact form where if someone needs to shoot me an email, they can go on either of those sites, and they also certainly have information about our services there.
Great. Thank you so much, Chris. Well, that's all for tonight. I'm pretty sure that I would love to interview you again for a different subject sometime, Chris, if that would be okay with you.
We'd love to.
And if you do want to get a hold of Chris and you're having some questions that I could help you with, I will give you a testimonial and help you understand what Chris can do and refer you to him.
Good. Thank you, Rick.
Thank you. Well, have a good evening. Thanks again, Chris.
All right. Good night.